Hey, Steph, how are you today? I'm really excited to have you on the Holistic Hub podcast as a guest.
I'm great. I'm really excited to be here. I know we have like similar stories and passions, so I'm really, really excited to be here.
Me too. And, something that really kind of caught my eye in a lot of your social media presence is regarding the interplay between like the fascia system, mast cell activation syndrome, the lymph system. So I'm really excited to dive into that today with you because I feel like this is a topic that a lot of people aren't making the connection between yet. So that'll be exciting. Can't wait to dive into that. But first, would love to hear a little bit more about you, your story, and what kind of got you started in the work you're doing today.
So, I mean, like most of us, it was my own suffering that kind of got me here. I was in chiropractic college planning on just being like a structural chiropractor. I was already working with athletes through my mentor when my health crashed for the first time. And it was almost like a hijacking, where I was completely normal one day and the next day I'm literally like my nervous system is completely shot. I am wired. I'm having muscle twitching everywhere. I want to jump out of my skin. I feel like bugs are crawling all over me. And then I had stroke like symptoms. And then I had Bell's palsy. And it was like nobody had the answers for me. They just kept sending me home. I would go to the hospital and then my Bell's palsy corrected after a day, and then it was just cycling through a sore joint, my hair falling out. Then I had bleeding bowels. Like it was just this acute and nobody tied anything together. It was allowed to become chronic. It was blamed like a lot of psychosomatic and all of this. And honestly, I had to really dive into figuring out on my own and really advocate for myself to really get to the bottom because I said, none of this makes sense. So eventually when they started taking me seriously, which is only when they, saw my face paralyzed, where they did their investigation, where they do nerve conduction velocity and electromagnetic, like when they put the big needle into your muscles to see. And eventually I got an MRI and, there was plaques, but there wasn't enough plaques that it was called multiple sclerosis, right? So then I was put in the watch and wait and I'm in an alternative school. No one's helping me there. I even went to like a naturopath school. No one was really tying it together. And that's when I started myself looking into stealth pathogens. And then I looked at the signs and symptoms of what I thought was a parasite at the time. So I treated parasites and it helped everything go into remission. And I wouldn't find out until a decade later that I actually had textbook neuroborreliosis and my Lyme was reactivated by COVID and mold. And it was only because I was already in functional medicine from all of my experiences before that I found that. And the way that it turned on, it was like the exact same, but this time it involved my heart as well. So I had all of the serious like POTS tachycardia. I had all of the, severe palps, which are painful and disruptive and scary, right? And then, trying to get help even when I sent my test and realized it was very acute Lyme that turned on. And my natural side of stuff wasn't working. I was doing high dose oil of oregano. I was doing all these other herbs and they were helping, but I couldn't even get conventional to believe and just give me like a small round because, when Lyme's that active, the antibiotics help the spiral shape to be killed. So I just wanted that short round and no one would give it to me. So it was like they didn't even want to help me in that way. Anyways, it's been very humbling again to get back into being unwell after having 10 years of full remission and then seeing how even more complicated things have become because of COVID, 5G, like all these other things, EMFs coming at us. And, I learned a lot and I learned through my own kind of experience, like the importance of things like lymphatic drainage. I had already, talked about the vagus nerve a lot, but like, feeling it again when it's hijacked like that, it's just like, it's a whole other experience. So I try and teach people that are going through it that there is light at the end of the tunnel, but it's a tough thing to go through, as I think and speak of as well.
Absolutely. Again, like you said, it's humbling. It's so amazing when I hear people's stories on here and then like I'm sitting across from you and I can see how much light you have inside you now, how much passion you have, how much like energy that you have now to help other people because you yourself have went through and you've been able to heal mostly from a lot of these different things that have occurred to you. And again, it's like giving people that light at the end of the tunnel that like, hey, I went through this. You can heal from this too, and you can
Mhm.
work through it. I'm just curious, like, what are some of like the biggest factors like you see play in a lot of these different chronic conditions? Like you had a number of different things going on, a number of different symptoms. Like, are there certain things that you feel get missed in today's world of even in like the alternative medicine world of helping people through these different conditions, like with mast cell activation syndrome, Lyme, mold toxicity?
Mhm. Honestly, one of the holes that we're trying to mend is the whole lymphatic side of things, and in a different way that I think it's generally being taught, because we're more diving into like the deep lymphatics and utilizing fascia to open up space. And with my background as a manual therapist who always treated different. I was a chiropractor, but my treatments were always like an hour plus. I was always assessing the whole body interacting with each other, right? Utilize that for me getting over some major roadblocks, right? So I mean, my symptoms were always so, I guess, like in your face. Like, I could see the severe lymphatic stagnation. Like, I would blow up here on my left side. So, for people who don't know about the lymphatic system, 75% of your body drains into your thoracic duct, which is on the left side of your body. And it's such a tiny duct compared to like the size of your aorta and your vein, right? And it has to
Hmm.
drain back into your heart. So I had this huge puffiness and like you could see it jiggling, right? So I kind of knew, and then I would miss, and when I had it really puffy like that, my heart palpitations would be worse, right? And my anxiety would be worse. And so some things I came up with was, first of all, your vagus nerve is pretty superficial in your neck, right? And now think about this traffic jam of mold, of whatever your body's trying to get rid of, like carcasses of parasites or whatever it is, like heavy metals, like, viral defects or like, yeah. And they're all stuck there. And that's what your vagus nerve is being bathed in. Now, that's when your vagus nerve is being bathed in toxicity, it's going to send signals up to the brain. And that's 80% of its job is sensory. So it's collecting information and bringing it to your brain. And now your brain's getting signals of jump out of your skin. Like, that's why I'm like, and what
Right.
would happen is I could massage my fascia above and below, and like, I'd really have to get in there. So this is the difference where we kind of teach, like, kind of like the fascial teasing, like not so much. I don't want to push on the nodes like other people do. I want to open up around them. The nodes are what are holding all the junk, right? They're the ones trying to fight off the infection. We don't necessarily want to slosh that around, especially if we don't have space for it to drain. So we're creating like a space for everything to kind of come in the end spot. So, we talk about the around the collarbones, which is common for everyone that is talking about the lymphatics. I think it's just a different way of addressing it. And so I would do that to myself when I had this puffiness, and I would get a bout of heart palps that were pretty intense, but then that floating, that like wave of lymphatics would have drained, and then my heart would calm down. It was like these kind of aha moments. And, a lot of what we're seeing in people when your lymph isn't moving and all of this waste is building up, like, of course, your mast cells are going to be overreacting, right? Like, of course, they want you to clear something, but you don't have the capacity. There's physical blockages. Like, another thing people don't understand is when you are full of toxicity, your liver makes even more lymph, but the lymph isn't rich in all of the cells that are usually in it. And it's just like watering it down. Like one of the other practitioners said, the solution to pollution is dilution. So our body's trying to dilute all the toxicity, and then we get even more puffy and we already don't have space. And then it's like all of these symptoms can show up, and the pain will be in the biggest choke point areas, and bigger choke points are usually really thick areas of fascial connections. So those are the areas that we kind of focus on to clear different body parts. And that's what we're teaching in our course that actually is coming out soon. So talking about it makes way more sense. But talking about it, but a lot of work has gone into it. So
It's really cool. You'll have to give me the link for the course coming out so I can link it in the show notes because that sounds awesome. So, something that really stuck out to me that you were talking about was how is about the vagus nerve, its superficial aspect here along the anterior medial neck, and how there's so much lymphatic drainage that is occurring there as well. And a lot of people that so like you, I'm working with a lot of individuals dealing with hypersensitivity reactions, mast cell activation syndrome. And a lot of people will say, I really try to do the nervous system regulation. I try to do all these things, doing the limbic system retraining, nothing's really budging for me. And I've been doing it for months. And a lot of times what really kind of breaks my heart a little bit is when people come to me and they've been like, yeah, I was just told I needed to do this and do this for 6, 8 months, do it for a year, and I will see changes. And they're like, they think it's on them that they are not healing. And that truly breaks my heart when I hear that, because I'm like, it's not on you. There is something that is stuck in your body. So my question to you is, do you see that the lymph system is probably a huge contributing factor to the reason why all that vagus nerve work that they're doing is not helping?
Yeah, I talk about this very thing because your vagus nerve, like I said, it is scanning your body and it's bringing information up. So it's not just the lymphatic. Well, the lymphatics just make things continue to build up, but you're getting mayday signs because there is a problem. And when things aren't getting better in a shorter term and they're becoming chronic, you have to intervene in more of a way than limbic system retraining. So, again, those things are great to use as tools to calm yourself down, especially when you're spiraling or when your body's done that big release of mast cell and you're trying to put on like the brakes a little bit, right? Because it maybe is an overreaction. But my heart breaks for those people too. I see them disappear for 2 years because also you can speak to this. It's not easy getting these toxins out of your body once they've taken hold. It is a whole process. And someone has to give you a realistic timeline too, because it's not going to be overnight especially if you see someone who's been having these symptoms for years. I mean, this is a total like peeling back the onion, peeling back the layers. This is also working through hard times. And I think preparing someone for that or giving them tools like the lymphatic clearing, even some of those breathing techniques or eye techniques just to get you out of this severe fight or flight. We use like binders a lot. We try to find things for people that will take the edge off when it's happening. And for me, binders, I mean, my symptoms all turned on the second time. I wasn't at home. I was in Las Vegas. I had to fly home with the most insane blood pressure changes, with the most insane heart rate. I literally thought I was going to die. I didn't fully know what was happening. And I had to take like a binder an hour and I had to rub my own shoulders to calm down. I was tapping myself with a toothpick, and I was doing all these things naturally, right? And I was able to just calm down one wave. I feel it coming. I would take it, calm down another wave, and I'm like, I'm okay. Yeah. But then I realized things that didn't work, like magnesium is usually calming for people. Well, magnesium in the short term, like for me, was very hyperstimulating. So it's trying to find those things for people. Like, what is your crutch? You need a crutch to get through this. A recent crutch for me, which is a little bit controversial, silver saved my life, like when nothing else was. So it's pH structured silver. I studied it. I understood it better. It has been magical for me, right? So again, it's just finding those crutches. And one of them, a big thing I see, like a day that could have been a very bad day for me, if I could work on my lymph, or I taught my partner how to treat me, my husband, my associate and I, we are the one coming up with the course together. So I could get a lot of treatment, but working on your own body or having someone be able to could change me from having a terrible day to having a day that was manageable, where I could calm down my symptoms if I could unblock these areas. And a lot of it was the chest, the head, if there was pressure. A lot of it's like the back of the neck, the front of the neck, the choke points at the back of the shoulder, because that coat hanger tightness that people get, a choke point for that is your quadrangular space, like a big space here that's responsible for draining the back. But it all has to come to the front. So we always have to open up there. But yeah, like big, huge changes for me. Like working on cerebral spinal fluid. I don't feel like people talk about that a lot as part of your lymphatic system. My spine was a big problem, like it is for a lot of people with Lyme and long COVID and whatever, like the shooting, like almost like meningitis like symptoms that I would get, like pricking and shooting into my legs from my back, the rib heads, like clearing around the lungs and everything, because a lot of people don't know that your lungs have its own separate lymphatic drainage than the rest of your body, and it's prioritized, and your ribs go stagnant, and then you can't pump your ribs enough. And then there's what we've found is like deep lymphatic stagnation around the heart, and think of the heart as something electric. And now think of squeezing something that is electric. It's going to jolt back at you. So we've been able to turn off heart palps by really clearing someone's chest. And when they're having the heart palpitations, you can feel how much tighter and puffier, and there's no space in their chest and in their ribs. So we're also going to like try and teach more practitioners, because again, a lot of the time if you look up and you're trying to find lymph, it's very superficial work. It's very like brushing and, so
Yep.
it's not really what we do at all. And we use the arm as the lever, the leg as a lever. We're always making sure, trying to balance, like, how are you rotating? So that component we need more people to do, because again, it's very specialized. It's kind of different way of looking at things. But again, we're trying to teach those concepts, like, and we teach different tools that you can use. Like, so even like beside me, I have like my cup, right? Like, so this can suction on and like pull the fascia and create space when your hands aren't good. And this has helped me through so much when I couldn't get someone else to help. When I had to do calls with people and I was in pain myself, like I'd be like suctioning this and, I had like kidney pain. I've had liver pain. I got a severe hiatal hernia, and then an oil of oregano got stuck. I got third-degree burns in my esophagus. Then they clipped it and I had acid. Like,
God,
I mean, I have had
you've had a
like
lot.
lot. I went to the washroom only blood for days on end, like severe,
Mm.
severe problems that I have gotten over. I have to say, like, I really can understand like a lot of what's going on. I'm trying to teach other people too, just like you are.
Yeah, absolutely. And well, what's so refreshing about what you're bringing to the table is that, again, it's like this other option that people can look into that probably is the missing link in a lot of like what they need to do to clear and get things moving again. Because a lot of times, like, why people are experiencing such horrendous symptoms is because their body is truly just stagnant. Like, I think of like a flowing river, like how a river is supposed to be like beautiful and flowing and clear and all this kind of stuff. And then when you see a river that's not moving, you see all the debris that builds up, the algae, like all the gross gunk that gets in there. That's essentially what is occurring in people's bodies. And a lot of times people use that analogy like with the gut, but I think of it from like a variety of factors. Like, how is the liver looking? How's the lymph looking? How's your kidney channels looking? So when somebody presents to your office and they're wanting to work with you, and let's say they're dealing with, a variety of things like you yourself have dealt with, I'm sure a lot of people that you and I both see, and they haven't had any fascial work. They haven't had any lymphatic work. They probably have tried doing a variety of mast cell activation supports and detoxing, but nothing seems to be working. You mentioned the cerebrospinal fluid as well. I'd love for you to just kind of bring us through like this interplay, maybe a little bit in more detail about how the fascia is related to the lymph system and how like that cerebrospinal fluid and the spinal alignment really contributes to kind of all this as well, and how they play off of each other.
Well, you have to think fascia is continuous in our entire body. And, it's supposed to glide and slide. And, just like when things become stagnant or if we have infections or debris, it becomes sticky and it doesn't look like a nice web anymore. It's just like, disorganized tissue. And so it becomes there's a physical component. It can become a physical barrier for our lymphatics. So the way our lymphatics run are under each layer of fascia. So when you see people treating lymphatics and they're just doing gentle and they're saying, oh, lymphatics don't have valves and they don't have muscular walls. Well, that's only true for your skin lymph. That is only true for that. Even the layer in your epidermis and then the layer in your deeper fascia that clears the organs, they do have muscles. They have valves. Actually true. So it's not just movement, right? There's a lot of ways that lymphatics move. They move electrostatically, and that's why mineral becomes so important. And that's important for our fascia as well.
Yes.
So our fascia can become an interference field through actual scarring, or it can become energetically blocked, even postural changes that happen when we go into fight or flight, or if we go into our guarding, like dorsal vagal, which is even the shutdown mode, we see changes in people's face, everything. Like, so the fascia is always responding. So there's that mechanical pressure. And when you see the actual deep lymphatics, they're right under the deep fascia. The superficial layer is right under the superficial fascia. So it's so intricately connected. And then, you add in the vagus nerve if you're in the fight or flight, and then, it contracts, your fascia contracts. And then so it's like this perfect storm that if, again, why it
Hmm.
has to be peeled back and manually helped. I think that's a big, I think the structural component might be a big miss thing, especially like think of all the telemedicine and this like we're not like touching people anymore. There was such like this void during COVID. So I think that like, you know, the mechanical pressure it responds to, the touch. I mean, I talk to people about grounding in order to help, revive the whole body and give that energy and minerals. But yeah, so there's a compression piece, there's the scar tissue piece. Like when you have long-term infections, like think of your actual vessels. So this is something I think is missed with POTS and everything that's being called POTS that's not truly POTS. It's like a lot of this turned on post-COVID. COVID enters your ACE2 receptors that line, they cause endothelial damage. They break down your glycocalyx, right? So does, and then they invite their frenemies to come out of hiding. So people don't even know they've had old Bartonella or Lyme. And they also love the endothelial lining. And so our lymphatics are so tightly tied to our circulation, our circulatory system, right?
Hmm.
So now think of these vessels that are now, not as pliable. Things are leaking membranes, so more lymph to clear, right? And then we have the actual like smaller vessels, like in our capillaries, where these bugs like to hide and they like to create fibrin nests. So we
Hmm.
have little nests of gunk that these bugs use to protect themselves and slow down so that not enough microcirculation and oxygen is
Hmm.
getting. And then there's more waste, and then there's more pain, and then there's more like fascial sticking together. So like again, that's why part of these treatments, like we're manually can break apart fibrin nests. We can take binders to bind up. We can use systemic enzymes that can go and break them up as well. But I do think that structural component is it's able to break down those microcirculation, like clotty issues that are happening, right? Yeah, and it's just like so much inflammation, so much sludge. Like, even you talked about the liver, like the vagus nerve's in charge of like contracting the gallbladder, and then this that turns into more like molasses instead of liquid, and then we don't get then the gut starts to get messed up because we don't get that good flow of bile, and then we don't get the strong reaction of the stomach acid hitting because they feed off of each other, right? So it's just dysfunction after dysfunction after dysfunction that's layered, and not a lot of people understand it. And then you even get patients and they're listening to you, but they don't really believe you, even though you've been through it, and it's not easy enough, and it's not the magic pill, and it's not. So, it takes a special type of person to get through this, honestly. It takes a lot of strong constitution, and there's really no choice once you're in it. So you might as well just go and
Go for
just go for it.
Absolutely. No, I actually had seen a post like yesterday on Instagram about someone saying like healing is not going to be easy. Like it's easy to get into the routines where you wake up, you have your cup of coffee, and maybe you go for, you get into your work routine, this or that. And like that's become like easy to us because we have our routines, but we
Mhm.
have to break free of these things
Yeah.
that we find easy to really work through a lot of problems that have built up over the years. And so I love that you spoke to that. And something else to um a point that you made earlier was talking about the pandemic and how we've all become like very isolated and we're not getting touched anymore. We're not actually having like these conversations like in person. And something that I have really come to realize over the years as a result of that is essentially what you touched on is that a lot of like dis-ease, a lot of these things are our disconnect from nature. Our cells that become inflammatory and creating different symptoms are because inflammatory symptoms are because they're actually isolated. And it's because we're not having that kind of connection anymore. And like we do need this kind of support, this structural support. Like that is very, very important. So that's why I really am so in alignment with everything that you're doing. So well, let's talk about somebody that then is dealing with mast cell activation syndrome. They're very hypersensitive. When you go to work with somebody like this, because this is going to be a lot of people that are listening that are, dealing with this condition, is if they wanted to start maybe looking into somebody that can support with fascial work, that can support with lymphatic work. Now, I know we could probably get into the details of that and how to maybe find somebody that is, worthwhile for them to see. But is it important for them to understand that they shouldn't jump straight into doing like an hour worth of body work? Because my question is as you're starting to release the fascia, open up the lymph channels, have you seen this possibly cause mast cells or hypersensitivity reactions to go a little haywire? So in some cases, you have to go a little bit slow, like maybe with the patients that you're working with?
Yeah, so I think in some ways doing too little stirs up some stuff, right? Like, so what we kind of want to make sure is that, again, the main area right here is loosened, like including the ribs and around there before we move to different areas. That's when I think we see less of the reaction, because if we start stirring up the belly and then we're stirring up the legs, like I'll give you an example. So we had a really sick patient, really reactive. He's done everything crazy. Like he's done all these great therapies. But like, I think just in isolation, like he's done Inus freezes, he's gone there and he's gone that. Like he's really, and you're like, okay, well, what can I really do for you? And so he starts doing the basic videos for clearing around the chest. Okay. And he gets so excited, and we didn't have a chance to talk again. So that's the only video that he had. But then he started looking up lymph and he's like, oh, okay, the big six, I'm going to start pumping those. And he was fine when he first started pumping, but when he got to the back of the knees and he pumped his back of his knees, the next day he woke up and he was a mess, in a bigger flare than he had been like in years. And then he was scared to touch here. And like I had to tell him, okay, no, just focus here. Don't pump the nodes and slosh around the dirty water without having the drains open. Okay. So if we think of this as the main drain and we mainly focus on that first, and then you move from here to maybe either the arms or even the back of the neck, like whatever, like people's symptoms are. So even if they're doing the course that we have, it's very symptom based. So say you typed in heart palpitations. I use that because that was a big symptom, and it's a big symptom. It'll populate with, first you clear like the chest, the manual, then here's the tools, then here's the stretches, then here's the breath work. Like, we do one vagus nerve, and then we'll just work on that area. But like, if your symptoms like in your back, we have to do also the back of your arms. Like, so, we're doing the smallest point. We don't want you to work on the other areas until you've had some time clearing here, but in a way that's maybe a little bit deeper than you think should be, because we find when you just do the superficial, when you have chronic complex illness, you're actually just sloshing around dirt with a closed drain. So, it could be
Yep.
settled and you could be at your baseline, and then you pump a bit and it's released, and think of the water getting all foggy and dirty, but now there's no drain open. Have the drain open, then we can get less herxing. It's actually a tool that I use when someone is herxing, is that like, why
Things
aren't you
up.
massaging this
Let it
chest?
move
Like,
through.
like, yeah. So again, I think there's going to be people that herx with anything these days. It's actually crazy, but mostly we see relief from this. And I'd say even the in-person ones, which we will do an hour with people that are sensitive, maybe just more in these areas, like we usually get a positive response. Even if it's a day where you're a bit more tender, like the tenderness is not turning into like the jump out of your skin anxiety. It's just like, you need to recover a little bit from that because the tissue's so stuck. Like, and I mean, even like movement wise, like we get people to move more in ways that like the opposite of the way your body gets stuck, just like opening, like, and yeah, because everything gets so stuck. And I think and then it makes you not want to move, right? So you get stuck in this freeze thing and things get even more gelled. And then you try and exert yourself and you're in pain and in having different symptoms. So it's just like, it's still peeling back the layers like one area at a time. But I think that's the biggest take home, like, not being so gentle that it's like just like sloshing it around.
Yeah, no, that actually you explained that so perfectly. I think that makes so much sense is that the reason why people are reacting possibly to even doing a little bit of dry brushing, I've had a lot of clients tell me that they have reacted to dry brushing. It's because, again, it's almost similar if you want to think about like if you try to add in a binder without supporting like the liver, the gut, the kidney pathways, right? The lymph pathways. Like if you try to do all that without having some form of drainage support, you're probably going to have a reaction. So it's similar to this where it's like if you didn't open up those specific pathways that you're talking about, probably going to have a little bit of a reaction. Something that you're alluding a lot to is that a lot of lymphatic manual therapists are focusing a lot of like superficial kind of, because that's what I think about too.
Yeah. And they're just
And I think a
pushing
lot.
it towards an exit that's closed, Just think
Yep.
of it like that. Just think of
Yep.
pumping and honestly, just the skin lymph even, like, and they're focusing on the nodes. So remember, the nodes are where all the fighting is happening, where all of the, immune cells are more like colonized, where they're the macrophage, like, it's like it's like the point when you disrupt it, like you're pushing those things out. And I'm saying open the drain, don't
Mhm.
pump the nodes.
Yep.
And,
Mhm.
and I mean, so you do lift the nodes like we do. We're creating space. There's a lot of lifting. There's a lot of, like we have different like kind of techniques. There's teasing, there's lifting, but not pumping. It's the pump
Mhm.
is like too gentle. And I know that
Okay.
people are going to have things to say about that, but this is from experience, like hands on with patients, which a lot of people can't say. Like a lot of people don't have hands on with their patients, right? Which is not a bad thing, but we are seeing those chronic patients like get over humps from very technically teasing and moving things, creating space.
So, a two-part question is one, what have you seen be big contributors to causing then this like stagnant lymph, this very stuck fascia? Are there like a lot of similarities that you're seeing in the variety of patients that you're working with? And then, secondly, I know every person's individual, but like once they kind of start doing some of this lymphatic work, like how much time might it take for somebody to start noticing like a little bit of improvement and certain symptoms?
So, I mean, once your lymph starts to stagnate, and let's say, okay, so, I think you talk about they introduced a whole novel wavelength for our body, and we're frequency beings. And so our cells respond to that. And what
Mhm.
people I think don't realize, or your listeners realize, but a lot of people, or if they're new listening, like they talk about 5G not being able to access our organs or our body. But they say it's safe because it only goes a few millimeters, but a few millimeters, we have the fascia and we have our sweat glands, and through they act like an antenna. So they actually can get access to our body. And there's a lot of weakening of the cell membrane because there's a lot of changing of the calcium signaling in our body. So I feel like first, not even first, but this is a common timing wise, that a lot of these symptoms became way more prevalent, right? That and like obviously a novel virus that creates a lot of waste. But think about calcium now dumping out of the cell, so the cell becomes damaged, and your body will just stick calcium anywhere in order to save you because it will literally, that's what calcium channel blockers block your heart from pounding too much. So think of like calcium signaling's gone. So much is leaking out of the membranes. And then your body's just putting it wherever. So everything's more
Mhm.
calcified, right? Like think of like calcium. So that's one major stagnation. And then you add the fact that every day we get exposed to toxins. So yeah, we're seeing the same things, right? We're seeing a burden of environmental toxins, a burden of mycotoxins. Because did none of us get zero exposure to mold? No. Like,
Yeah,
you know,
exactly.
and like, so, but now you're more calcified. You've got this other infection that's changing your immune system, and they all work to stagnate something, right? They are trying to like survive, right? So the common things that we see are the big lymph stagnators like Lyme, Babesia, Bartonella. We know that COVID is turning on different ones of these because of how it changes, it creates this inflammation, changes the immune system. We have these opportunistic bugs, and people don't realize that they've been, harboring, our body's been harboring them for maybe our entire
Mhm.
lifetime. Maybe we were born with them.
Mhm.
It doesn't have to be a tick, a mosquito, a flea. It doesn't have to be your cat, your dog, but often is too, right? And then there's the whole other parasitic load in your gut. Like, so it's just like, again, it's like this, and we know like the spike protein likes to go into the liver and stagnate that. So that makes a lot of our lymph. So it's just like those are the common things. And then there's novel treatments that have come into play that have been shown to like make things turn more jelly. So, I mean, those are common things that we're kind of seeing. And then again, we're separated from, like, we're living in condos, we're not touching the earth a lot. So I think our water's dirty. We're like trying to get you to just like even make your home a safe place. But yeah, I think that's where like minerals, cell membrane health, all of that. But those are the common things that we're seeing for lymph. And I don't know if I answered your whole question or if I missed part of it.
No, no, you absolutely answered it. I actually had somebody on yesterday like the whole podcast episode was just regarding EMFs because that's something I'm very passionate about talking about as well. So I absolutely love that you brought that up. And then also, you kind of a couple times now have touched on minerals. Something that I'm super passionate about talking with people about is supporting your body inherently, like with the way our ancestors used to, right? Like we used to be able to eat such beautiful mineral rich foods. So going to the farmer's market, getting more mineral dense foods, remineralizing your water, a lot of that stuff can do such profound effects for your health by just doing those couple of things. But another thing that you keep touching on that I'm excited to just have people be aware of is that the lymph support that they're doing could possibly be counterproductive to them getting better because they're just recirculating things that is not getting drained properly. So if somebody is wanting to kind of dive deeper into this, of course, your course sounds absolutely amazing. But if somebody wanted to go get in-person work, what are things that they can maybe ask providers to make sure that they would be getting like at least some of the work that you guys are doing with patients if they don't live near you?
Yeah. So what I try and get people to do is see a provider that's good at soft tissue work. And then even just say, like, sometimes it's not even like I need lymph drainage. It's like loosen my pecs. Like because when you loosen the
Okay.
muscles like this, like you're working on the fascia too, and the muscles become tight too. So we're always using the arm as a lever and we're like, this is tight, and we're working here, we're working under the arm, we're bringing it up. Like, so honestly, if you can get someone that knows soft tissue to work on your chest and neck, like to clear this in a way that's like even just when you're touching muscle and stretching it out, like if they do like maybe like a pin and stretch technique,
Hmm.
some people know about ART, which is active release. If
Yep.
they're
I love that
focusing
technique.
yeah. So if they're focusing on your chest, on your traps, right? On above and below, like that big opening that people call the termini, where everything drains into, you're going to create space, right? Like, so all other things, like there's other, like I said, if you're like, can you work on the back of my shoulder? Like, I think if you find someone really talented at releasing a shoulder and they can release your left and right, like you could get a lot of relief, right? So that might be an easier way. A lot of times for like head symptoms, cerebrospinal, I tell people because osteotonia is a very like across the board. I've gone to multiple cities. Like if I am having symptoms and I don't have someone with me that can help me, I will find someone and I'll say, I'd like a massage, no oil. It's like a TCM kind of technique. So they leave the sheet on and they use mostly their elbow to do along your spine, but they'll always come and they'll do like a little bit here. And then, but my thing is once they do your spine that much, if they don't work on your chest, you have to ask them like, to work here, or you've got to work on it yourself after because everything's going to come forward from your back. But that's more for people with the cerebral spinal, like headache kind of thing. Maybe not mast cell, because I feel like mast cell, like the full blown, when you're like jumping out of your skin, when you're like hiving, rashing, like that's like too much when you do your back. But yeah, I'd say for them, like someone talented at opening up your chest, working on the fascia on the sternum. If someone's like a fascial specialist, like all the sternum over the ribs, like even laying on your stomach and having someone releasing your rib heads, or even just pumping your ribs after working on the front, like the rib cage, like if you can get that and like even stretching your rib cage, opening up that space, that was so relieving to me on those days. That's why I came up with that system where we do the soft tissue and then you do the stretching, because like it creates this opening, this space, right? So that, and we use topicals too. So like if you're rubbing castor oil, that helps open up, like for people that can handle that, but not just on your liver, but over your collarbones, it can help like, yeah. So, and then there's other things that can go deeper that we start to use. And like, we do a lot topicals because a lot of stuff gets stuck in the fascia. So like immunocreams, like I bought an oxygen bath because because think of the microcirculation issues that you have, but now you're in nano oxygen bath and it's getting through your skin. It's so calming talk about calming for your vagus nerve. That was like the best sleep I had when I was like in this fight or flight when I went into one of those oxygen baths. So yeah, think of like things coming into the body too through the skin. Like, I mean, humbling again, all the different orifices that you have to enter in
I
order
know.
to really get rid of these things, like, rectal suppositories, we through our ears, nose, back of the throat, like, all of those things. And then, oh my gosh, for draining your head and face, like finding someone that does, the intrabuccal massages now, how they're becoming. more, but
Yes.
people are using it for like anti-aging. I mean, that helps drain your face. Like I had to get like a very deep tongue tie cut, and the amount of symptoms that turned on when the lymph wouldn't drain from under my tongue. Like, so then we learned
Gosh.
how to, in a profound way, like drain the face, tongue, mouth. Cause, even the whole like infection in your tooth,
Hmm.
or which is a chronic infection, like anywhere where you have those interference fields, if you can help clear them, if someone has something and they can't get it out, we're using oils over top that help kill a bit, like swishing maybe and spitting out some silver. Like, just a lot of different techniques to support.
Fascinating. Fascinating. It was like a few years ago, I had a improperly placed crown on a tooth and then a few months later, I started to get this symptom, like I was starting to get pain. It was in the back, lower left back. And I was like, what is going on? So then I ended up going to see a different biological dentist here in Carlsbad. And it did a cone CT scan. And of course, here we go, had a infection in my tooth. And so had to go through the process of, getting it pulled. Then I had an implant. He was absolutely amazing. But I was getting all this pain that was here, trigeminal nerve pain, all this stuff. Anyways, it even persisted after I got the tooth extracted. But a lot of my other symptoms had really improved. I was sleeping better again. I was actually getting heart palpitations from it. It was crazy, which I'd
Yeah.
never experienced before. But then I have a wonderful therapist here who does active release technique that did a lot of work around here. I'd say 90% of it really improved. And I was like, wow, like just amazed at the fascial work that he did that helped me. But this kind of again leads me to thinking, like, I've actually wondered for myself, like lymph system, like all that stuff that I dealt with the hidden infection here. What you're saying makes so much sense to me, is regarding like, you have these things that kind of pop up. You need to support the drainage of that throughout, even if maybe you removed the issue, right? Like you still need to support that. So kind of what you're talking about with supporting the face, supporting the neck, supporting the head, is that kind of tie into the lymphatic system a little bit too? Is that kind of what you're alluding to a little bit, is like supporting that drainage as well?
Yeah, 100%. I
Okay.
mean, so if you think about even chronic infections and like the whole like above the collar infection kind of thing, so like
Hmm.
how like mark-ons or even the tooth infection or infections anywhere, because they have direct access to your brain, and then your brain thinks fight or flight, you can get way more systemic symptoms too. So like obviously the head and face are like a big priority too after just opening up the drain, right? Like then
Right,
you want to
right.
drain the face and head, and it's just more complicated. And again, an improperly or only partially drained where it's stirred up, then you can stir up symptoms. So that's where like, we're kind of toying with how much do we go in the mouth to show people, like, it,
Right.
because we don't want anything.
Getting too stirred up than
And
it
I know
already
how
is.
terrible it is.
Yeah.
Gosh.
Yeah. So something that you were kind of talking about before is like supplemental wise, like you were talking about like proteolytic enzymes, things like that can maybe help a little bit with some of that lymphatic system. And something I'm a big fan of, I love like certain teas that can be like gentle and helpful. I love like cleavers or red root tea to support lymphatic system. You don't need to go too much into detail regarding this, but are there also like maybe supplemental supports that you've recommended depending on your patient, on like also that just helps like more internally to help support the lymphatic system while
Yeah.
you're working through the
Mhm.
physical work?
Yeah, and I find it so interesting because you did mind like mention the drainage, and like I even see these days like even like homeopathic drainage like stirring people up, sometimes I'm like,
Oh, I've
and
seen
it's
that too.
so different. So sometimes it's like they do better with the herbs, or they do better just with one liver support and then go to the binders, or do better with binders without drainers. So it's such a
Hmm.
humbling experience because it's like,
Everyone's unique.
everyone's unique. So but yeah, we use a lot of like blended that have different, red root is always a big one, cleavers, but
Hmm.
like we use supplements that are already blended. Sometimes we'll start with a tincture. Sometimes like our order, which we would love to do, but we do, we see how the person responds, is we
Of
start off
course.
with more like the homeopathic, like spagyrics, like the
Hmm.
Itiris kind of thing, like, the picanas
Yep.
or something along those
Love
lines.
those. Hmm.
And then we move into the more herbal, just to see, because sometimes people are sensitive to phenols that are in the herbs, like, and so you start off low and we microdose and build up. We find the binder that they like and or that works for them. And then yeah, we're always supporting drainage of the liver. Like we love like things like Tutka, and
Oh, yeah.
we love things like Silymarin to heal up the liver. Like and again, we just have to gauge with what their body
Hmm.
wants at that time. And then, we're layering in the red light, which helps lymph move as well. Like for, again, this is topical, but for what people can handle, because we've had people react to just a tiny bit of red light too. And that's
Yeah.
why you just gotta, for me, red light, the more was better. Like it
Okay.
just saved me. So we use it like over the chest a lot to help as part of one of the tools for lymphatic drainage. And but yeah, I love teas because again, you can just dilute them as much as you need. Or the tinctures, we start with 1 drop, water it down, just take a
Yeah.
shot of the 1 drop. Like,
Mm-hmm.
like
Yep.
so yeah.
What about infrared sauna? Do you find that to be helpful for lymphatic support?
Yeah, I do. And I find that again, it's hit or miss. Like for me, magical. Like would take my pain away, could help me so much. Other people, it flares them. So you
Yeah.
gotta just find
It's
like
always
timing. But
unique for sure.
yeah.
Yeah. Yep.
Yeah. But I really love sauna. And like when you look up research of, sauna and how sauna is like a detox, you're sweating, all of that.
Mm-hmm.
Like, they have lots of research on it because it's part of traditions in a lot of places. And they find people like all cause mortality is way less. Like I wish I was,
Mm-hmm.
saunaing in between because it's like I got healthy and then you get busy, just like you say, you're in your routine and you think when you're feeling fine, you don't have to sweat out these
Focus so
toxins, but
much.
that's the best time to do it.
Exactly. I know. Yeah. Stay ahead of it. Awesome. Well, would you be able to kind of tie all this together for the listeners? Because we touched on so many amazing points. So let's say someone's listening to this and like, wow, like this sounds like it's the one thing I haven't tried yet is like supporting my deep lymph, supporting my lymphatics in general, my fascia, and then tying the vagus nerve work into that. So can you just maybe like tie it together on like if someone's just listening, they're like, where should I even start? What could they maybe just like, what are some take home points for them, like out of all the amazing information you gave and just kind of supporting this person and being like, okay, maybe these are the first steps I can take to helping me?
Yeah. So the basics, well, if you go to the real basics and the foundationals, again, clean water, get your house as low tox as possible, get those minerals in. When it comes to the lymphatics, like, you know, just start working on the chest area. We have some short videos on YouTube that were made when I was going through my heart palps and people find them it's short and easy. Like those are just the areas that I would start on. And like we're going to start releasing more like little clips and stuff like that just to like, start to help. I'm trying to think of other pages that already have them out, but it's, we kind of like original thought the whole deep lymphatics, no one was talking about it. So, our course is just coming out now, but we've been talking about it for the last 6, 7 years. And we've been working on it for longer than that. We just, didn't really realize it or so yeah, I think just like when you're just starting, you're just working around the collarbones and you're teasing above and below and you're stretching your pecs and
Stretching.
doing things and then opening your ribs. Like even like our favorite rolling thing is called the rolga because it has space for your spine. And we talk about how important like the rib heads are. And we also know a lot of these patients have like that coat hanger tightness. So just rolling your rib heads on that area and like holding it on certain spots and breathing into it can be so powerful, like rolling out the side body, like, just like, again, just that area where think of your patients where they have pain, like, your neck into the top of their shoulders, into that mid back, that coat hanger tightness, the Lyme hug, MS hug. Everyone has a different
Mm-hmm.
name
Mm-hmm.
for it. Terrible, terrible feeling to have. So, that's the areas, these are where everything gets stuck. When things can't get through, they stagnate to the back and they fill these small areas that aren't like meant to have that. And they're also full of waste. So then you're getting these chemokines like sending out these mayday signals that create inflammation. So if we can push some of those out, working on the back of your shoulder. So I guess it's like shoulder girdle, ribs, stretching like spine stuff, like, just cat cow, like I have a
Yeah.
lot of arm stuff, like the eagle arms, get those type of things in and you can give yourself a better day. You can help yourself and it's not hard, but it is hard. It feels hard when you're going through it. Yeah.
Absolutely. Yeah, a lot of it is so empowering because a lot of what you're touching on this whole time is just stuff that you can kind of start doing on your own, starting from basics, water, nutrition, environment, to then moving into like stretching, pulling out, heart openers, chest openers, right? Supporting the rib heads, like a lot of stuff that you can kind of just do at home at your own pace without feeling like overwhelmed that you need to find like the nearest and closest practitioner that you can try to go to see if like you can get some support. Last question here before I let you go is, when does your course come out? So people can look into it.
So we are just finalized our slides, the theory part. All of the videos are done for our first body parts because we're releasing it in body parts, first the
Okay.
chest and then the abdomen, and the head and neck is a big chore. But once you buy the course, as they come out, you'll have access to the next body part. So within the next few weeks, it should be up on our app that was already made. So yeah, it's exciting.
That is exciting. Well, by the time this is released, then it will, by the time this episode airs, that sounds like it'll probably already be out. So I'll make sure to definitely link it in the show notes. But this was absolutely amazing. Thank you so much, Dr. Stephanie. If you have any final words for the listeners, please let them know, and then where people can find you.
Yeah, I'll say just don't give up, even though I know that sometimes it feels like that's all you want to do. There is an answer. It's not always easy, but there is a path out. So just keep teasing away at each layer and find someone you trust to help guide you through it, and your body can heal. So that's my overreaching thing I
Thank
want
you.
people to know.
I love that. And where can people find you to work with you? I don't know if you do virtual consults or where they can at least find your course, like website, social media, all that stuff.
Yeah, so we actually have my Vegas clinic Instagram, then there's mine, Dr.S. Canestraro. We have vegasclinic.com. We have our YouTube channel. We have our podcast, What Happens in Vegas, which you're coming on mine.
I'd love to come on yours, and I love the name of your podcast.
And then we have Lymph and Fascia docs. We'll start to populate that page. That's the Deep Lymph and Fascia docs is our new Instagram. So yeah, it's me and Dr. Leah. She profoundly helped me through all this, through my suffering and her, us guiding each other along. We really came up with this technique. So yeah, we're really excited to unleash it.
Awesome. Well, thank you so much. I'll make sure to link all that below. Thank you so much. This was amazing.
Thank you so much.